Uterine malformation and infertility. There are many causes of infertility. Among them, a portion of uterine causes is congenital uterine malformation. Why does uterine malformation occur? The uterus is formed by the fusion of two Müllerian ducts. During the fusion process, if there is obstruction or interference, it can stop at a certain stage or even cease to develop. The most severe uterine malformation is absence of the uterus. Actually, absence of the uterus doesn't mean there is nothing. It is a malformation where uterine tissue fails to form the uterine cavity. It often accompanies congenital absence of the vagina, hence called stone girl. Next is bicornuate uterus, where each Müllerian duct forms a separate uterus and an accessory structure. Even two accessory structures, some have 4 pairs and some have 2 pairs. Then there is unicornuate uterus and rudimentary horn uterus. One communicates with the vagina, while the other does not. In some patients, there is a disproportionate ratio of unicornuate and rudimentary horns, one being a large unicornuate horn and a small rudimentary horn, or vice versa. The proportions vary due to the malformation. A milder malformation is uterine septum. And there is also infantile uterus with a disproportion between the fundus and cervix. These malformations can lead to infertility, miscarriage, ectopic pregnancy, biochemical pregnancy, and other pregnancy failures. The clinical diagnosis mainly relies on panoramic 4D color ultrasound and dynamic digital hysterosalpingography. There are also hysteroscopy and laparoscopy. Other diagnostic methods such as MRI and CT are not of great significance because they are static. We have ultrasound and dynamic digital hysterosalpingography, as well as 3D hysteroscopy for examination, which can not only detect flat issues but also provide a 3-dimensional and comprehensive view. Special methods are necessary in the treatment, such as uterine reconstruction. Uterine malformation must be reshaped to achieve a normal uterine form, which is the real cure. For stone girls who have lost their way in the vagina and uterine tissue, we can also create a new vagina and uterus for them, transforming them from being without a uterus and vagina to having both. And they may even have normal menstruation. For other malformations, we perform reshaping using 3D laparoscopy. Most doctors can perform reshaping procedures, but many fail to successfully form new secondary injuries after the procedure, resulting in adhesions and more troublesome dysmenorrhea, without curing infertility. It becomes a case of losing more than gaining. Beijing Antai Hospital invented the uterine shaping device. After performing uterine corrective surgery, we implant the shaping device into the uterine cavity. It forms a pear-shaped uterine cavity, with the upper part occupying 2/3 and the lower part occupying 1/3. The uterine shaping device is a unique invention of Beijing Antai Hospital. And this shaping device is particularly advanced. Just like a shoe last, putting it in a shoe gives the shoe its shape. Having this device is a must for uterine corrective surgery. Without it, there is a higher risk of causing more serious damage. Beijing Antai Hospital implements contracted treatment. If there is no normal uterine shape after the surgery, a full refund is provided. This review summarizes uterine malformation and infertility. 4 patients with different uterine malformations. It is important to undergo correct diagnosis and uterine shaping surgery to achieve their own biological children.